Uzazi Salama Rukwa project is a 3.5 years project aiming to reduce maternal and newborn mortality and morbidity in 4 underserved districts of Nkasi, Kalambo, Sumbawanga Municipal and Sumbawanga District of Rukwa region. The region was strategically selected for implementation of Uzazi Salama Rukwa project due to its poor performing maternal, newborn sexual and reproductive health outcomes as a result of the low quality and limited availability of gender responsive and adolescent friendly maternal and newborn health, sexual and reproductive health services, as well as detrimental health and nutrition practices. Through the use of 2-pronged approaches in addressing the demand for and supply of maternal and newborn health, sexual and reproductive health services, the project has made significant achievements in its major interventions. As of September 2019, the project has managed to establish and equip 14 kangaroo mother care units to serve newborns with low birth weight. In order to increase knowledge and demand in accessing maternal and newborn health, sexual and reproductive health services among women, adolescent girls, and the community in general, the project used an approach of engaging the trained 264 community health workers and 264 community resource persons allocated in each village in the region responsible for conducting household visits and sensitizing the community on antenatal services, postnatal services, facility deliveries, family planning, breastfeeding and nutrition for children under 5 years old, gender equality and women empowerment. As a result of this, a total of 25,413 clients benefited from family planning services, reaching 53,018 pregnant women and 155,265 children under 5 years of age. Maternal deaths decreased from 71 to 44 and neonatal deaths decreased from 724 to 537. Institutional delivery increased to 114.3%. Accessing of postnatal care increased significantly by 96.48%. Pregnant women who received antenatal care by a skilled birth attendant at least 4 times increased from 58.9% to 121.3%. Uzazi Salama Rukwa project has in place a gender strategy which works on integrating gender equality in every aspect of the project using 3 cross-cutting gender transformative approaches. Through these, the Uzazi Salama Rukwa project has managed to improve availability of essential maternal, newborn sexual reproductive health resources that are adolescent friendly and gender sensitive for boys and girls in the region by training 216 female and male peer educators of ages between 15 to 19 years, 64 paraprofessionals, and introduction of 28 youth-friendly services centers.
This is a group which is across different areas, so we also use sports bonanzas. We know young people do like a number of sports, so we engage them, we prepare sports, different sports being football, netball, any kind of sports which they like it, and then they come into a group, they meet, they have those activities, but at the same time we engage peer educators to provide the health education during the breakout session.
Economic and social capital form a major barrier to a lot of beneficiaries in seeking and undertaking modern health practices associated with sexual reproductive health. As a countermeasure, the project established 135 mothers' clubs and 93 village saving loan associations, which influence women and girls of reproductive age to learn and improve their knowledge on maternal, newborn, sexual reproductive health and increase their social networks to generate income, which will influence them to make decisions and access maternal health services through a social fund. A total number of 540 pregnant women have benefited from the use of the social funds, amounting to 13,782,315 Tanzanian shillings collected from the Village Saving Loan Association groups. The second element of the Uzazi Salama gender strategy is focused on engaging men and adolescent boys to become active partners of change to promote gender equality in maternal and newborn health, sexual and reproductive health access, and utilization, prevention of child, early and forced marriage, gender-based violence, and delaying pregnancy. This was achieved through the establishment of Fathers Men's Clubs as a support platform. Overall, the project established 109 such clubs within the region. Uzazi Salama works on improving services by addressing supply-side gaps specifically with the primary duty bearer as part of the process of improving delivery of services at the health facilities. The project has worked on improving maternal data, reporting through the established feedback mechanism at the health facilities, health management information system, and through quarterly data review meetings to discuss and report maternal, newborn, sexual and reproductive health data collected in the villages.
Kwa sasa naweza kuzungumza kwamba kuna maboresho yalifanyika pande zote, kwa maana ya wananchi kupata taarifa ili waje kupata huduma, lakini pili upande wetu wa watoa huduma kuhakikisha kwamba mahitaji ambayo tunataka wakija wayapate yawepo, kwa sababu tunafanya uhitaji kuongezeka baada ya wananchi kuwa na taarifa, lakini na sisi kwetu inakuwa ni changamoto ya kuhakikisha kwamba mahitaji au huduma ambazo wanatakiwa wazipate wanazipata kwa usahihi.
One of the major challenges in reducing maternal and newborn mortality and morbidity in the region was infection prevention, which was caused by poor water infrastructures in the majority of the health facilities in the region. In order to address the demand, Uzazi Salama Rukwa improved water infrastructure and conducted waste management training to healthcare workers. This has contributed to increased levels of sanitation and hygiene in the region, with particular impact among children and women in the region.
Uzazi Salama has been funded by Global Affairs Canada and has been a very successful project in Rukwa region. It has been successful because of its strong partnership approach, and we greatly value the partners that we've worked with. Plan International with Shipaigo, Africare, the White Ribbon Alliance Tanzania, and of course with leadership from the Ministry of Health, Community Development, Gender, Elderly and Children, and our local government authorities.